Hi, Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. One common condition we treat at our office is herniated and bulging discs and sciatica. Now, normally in our office, we would use a spinal decompression table to help relieve that numbness and tingling or the burning pain that's shooting down your legs. But now with everyone working at home and not being able to make it into the office, I've been searching to find another alternative for patients. So the best alternative I've found is this device called the Fisher traction unit. They have both a neck and a lower back, so depending on what you need, or if you need both, you can purchase them from them. What's great about it is all you need is a door to secure the unit in, and then I'll show you how you can apply that for your lower back and for your neck. But I highly recommend this. It's a cheaper alternative than like an inversion table. Doesn't require any big space or anything like that, and you can also travel with it, so it makes it very convenient. It's not obviously as good as a spinal decompression table like we have in our office, but it's a great alternative. So this is what a Fisher traction unit for your lower back looks like. So there's a strap here with the red handle that goes around the actual door handle, and that gets secured into the door. Then there's this portion of the unit which is basically going to create the traction in your lower back. And then we have this portion here, which is what wraps around your lower back and pulls on your pelvis as we're getting the traction there. So what I'm going to do is I'm going to show you how we would set it up in the door, and then I'll show you what it looks like once it's applied. Okay, so what we're going to first do is we're going to secure this loop around the door handle. So we're going to open up the door. We're going to actually put it on the door. And then what we're going to do is we're going to make it flat and secure it above the actual locking mechanism. There we go. And then what I want to do is I want to pull on that unit just to make sure it's firmly in place. That looks good. The next thing we're going to do, I suggest doing this while you're standing up. Just put the unit over your head and roughly just kind of get it settled around your lower back and pelvis area. Then what we're going to do is we're going to sit down. And what we want is we want this unit to be, the belt should be kind of right around the belt line in the lowest part of your lower back. We don't want it to be higher up, or especially high like that. We want it to be as low, but right around that belt line is a good kind of starting point where you can figure that out. Then what I want you to do is I want you to lay down. And they say you can either do it with your legs bent or your legs straight. I feel like I get more of a stretch with my legs bent. It allows my hamstrings to relax a little bit. And what I'm doing is I'm feeling a really good pull right now in my lower back. And it's just taking the pressure off the nerves and giving those discs some space to breathe and relax a little bit. Now what we can do is if we wanted to decrease the pressure, this little loop right here, if you pull on it, gives it a little bit of relaxation. Now with a spinal decompression table, typically it stretches for 45 seconds and then relaxes for 30. The problem with inversion tables is unless you flip back up, you're not going to get that relaxation. What I like about this unit is there's a simple handle here, and you just pull on it, and you can hold that, it takes the pressure off. It's that relaxation period for the spinal decompression table. And then you can relax again. So typically I would recommend ideally holding the stretch for 45 seconds and then relaxing for 30. And you just do that for about 15 to 20 minutes. Feels really good, just feels like a really good stretch in my lower back. Again, you can straighten your legs. I feel personally like I get more of a stretch when I bring my legs up like that. You could also put a pillow underneath your legs to give you even more relaxation, but this works pretty well. And depending on how big you are and how much of a stretch you need, you either may need to move further or closer to the door, just depending on the stretch. But again, to relax it, what you would do is you just pull towards you like that, and that gives it some release right there and takes the pressure off. And then if I wanted to stretch it again, just relax. This is a great alternative for at home, or even if you're traveling, it can be folded up really easily. I highly recommend this for patients. So that's what the Fisher traction unit looks like for your lower back. Now here is the Fisher traction unit for the neck region. So same kind of principle. You're going to have this part that's going to loop around the door handle and then secure in the door. This is the portion that's going to apply the actual traction for your neck. The difference is on this one, we have a harness that's going to go around the base of your neck, and it's going to be applied right around this area, right below the occiput, right between the upper neck and occiput area there. That's going to secure there. There's a left and a right. And basically when you lay down with this, what you want is, as far as how to gauge how far away you are from the door, when you fully stretch this out, it should be roughly around in between your mouth and your chin, this end part. So I'll show you that as far as the setup goes. So what we're gonna do, again, we're gonna lock this in the door and then I'll get you set up and we'll show you that. Okay, so we're gonna secure this around the door. So again, we're gonna put the red loop around the door handle here. We're gonna put it above the latching mechanism and just pull on it to make sure it's in the right position there. That looks good. So again, what I was talking about before is I want to be positioned on the ground where that portion right here on the end is going to be positioned right so it's right between my mouth and my chin. So I'm going to lay down. So this is the ideal position. It should be, again, right between my mouth and my chin, and it is. And then again, there's a right and a left, so we're going to obviously put it on the right and the left side. So we're going to place it Okay, so now we have the unit secured in place. And so it's right on the base of my occiput, right between my upper neck and my occiput. So what it's gonna do, it's gonna be gently pulling and stretching the neck and taking the pressure off the nerves in the neck and upper back. So if you deal with any numbness or tingling that's shooting down your arms, this is gonna be a great home unit for you. And again, just like the low back, if I wanted to take tension off, I could just pull like that. And again, so up in the neck, I typically want to stretch for 30 seconds, and then I want to relax for 15 seconds. So after that 30 seconds, just gently pull, you get that relaxation, and then you get the stretch. So again, a real simple unit. You could travel with this, you could keep this at home, doesn't take up a lot of space, just use it as needed. But I would say if you're dealing with any kind of neck or lower back issue where you're having any radiating pain or any numbness or tingling, this would be a good option. Obviously the best treatment would be in the office, but for people that are stuck at home or traveling, this is a great option. So if you're suffering from any lower back or neck pain, any kind of numbness or tingling or radiating pain down your arms or your legs, I highly recommend you look at the Fisher traction unit. It's great for when you're at home. It's also going to be great when you start traveling again. And it's a great little alternative to the option we have in the office. If you have any questions, reach out to me at 703-912-7822. Or if you need to schedule an appointment, go to novachirowellness.com.